Begin by washing your hands. Introduce yourself to the patient and clarify their identity. Explain what you would like to do and obtain consent. The patient should initially be laid on bed and exposed from the waist up. Begin by making a general inspection. You should be looking for whether they are comfortable at rest. Do they appear tachypnic? Is the abdomen flat or distended? If enlarged, does it appear symmetric or have distinct protrusions? Check for skin temperature, color, scars, striae, dilated veins, rashes, and ecchymosis. Check for the umbilicus, for its contour and location, or any inflammation and bulges. Also check for the obvious abnormalities such as scars, masses, and pulsations. Auscultation for bowel sounds may be carried out before percussion and palpation. Using a stethoscope, listen with the diaphragm next to the umbilicus for up to 30 seconds. High-pitched sound may indicate obstruction. Absence of sounds may be caused by peritonitis. Briefly percuss the 4 quadrants of the abdomen. This will help you determine the distribution of tympany and dullness. Tympany predominates because of gas in the gastrointestinal tract, and dullness would suggest underlying mass or solid organs. Palpation of the abdomen should be performed in a systematic way using the 9 named segments of the abdomen. If a patient has pain in one particular area, you should start as far from that area as possible. Initial examination should be superficial using one hand. You should feel whether the abdomen is soft, but you should always be looking at the patient's face for any signs of pain. A deeper exam is performed with 2 hands, one on the top of the other. Again, examine all 9 named segments of the abdomen. Identify any masses, note their location, size, shape, consistency, tenderness, pulsations, and any mobility with respirations or pressure from the examining hand. Palpate the liver, spleen, and kidneys. Palpation for liver and spleen is similar. For the liver, press upward towards the right hypochondrium. You should try to time the palpation with the patient's breathing in, as this presses down the liver. A distended liver feels like a light tap on the leading finger when you presses down. If the liver is distended, its distance from the costal margin should be noted. Palpating for the spleen is as for the liver, but in the direction of the left hypochondrium. The edge of the spleen, which may be felt if distended, is more nodular than the liver. To feel for the kidneys, you should place one hand under the patient in the flank region and other hand on the top. You should then try to ballot the kidney between 2 hands. If the kidney is palpable, describe its size, contour, and any tenderness. Do it again to the other side. Palpate the bladder by starting at the umbilicus. Move in steps downward towards the pubic bone. Normally, the bladder is not palpable unless it is distended above the symphysis pubis. Check for tenderness. As you end the examination, record the findings and report it to the patient and the attending physician.